Once I took it over, it's plasma. It's just plasma. So, that's not. It's analyzed. And there's a difference because,
Good morning, everyone. I'm Russell Myers, CEO of Midland Health. This is our coronavirus update for Wednesday, April 15th, 2020. Beginning with the numbers in the state of Texas, over 14,600 confirmed cases now. In Midland County, 33, 318 deaths in Texas, and 2 in Midland County. We have been continuing to test in significant numbers at the hospital's testing site. Now just short of 900 samples have been gathered since the beginning of the pandemic. 36 of those have been positive, including a couple of repeat tests, 741 negatives. We're waiting for results on 116 cases, the majority of those just in the past 2 days, but a handful going back to last Friday. Hospital census, in our overall capacity, we were at 120 patients. In the CCU, we have 14 patients today. Persons under investigation, there are 3 in the CCU, critical care unit, and 6 in other locations for a total of 9. 4 of those 9 are confirmed positive for COVID-19. In the emergency department yesterday, we had, I think, the lowest number I've seen since we've been reporting, which was 75 visits. And we have a total of 7 patients on ventilators throughout the hospital of our 44 full-service ventilator capacity. News from yesterday that was significant. You may have seen the press release from Midland Health Department regarding multiple cases of positive COVID-19 tests at the Midland Medical Lodge. We began learning about that yesterday afternoon. There are both employees and residents of the medical lodge who have tested positive. There's been a significant effort on the part of the clinical team at Midland Medical Lodge to gain control of that. And we have been in contact with them. Yesterday, Dr. Wilson and the medical director of the medical lodge spoke, and we expect to be in contact with them at least daily so that we can anticipate the course of treatment of those residents, and if that should become a source of a significant additional population that is headed for the hospital, then we're well prepared for that. As you may have suspected, around the country there have been perhaps the biggest areas of outbreak have been in nursing communities. It's one of our biggest concerns that is a population of older and more vulnerable patients who could become ill in large numbers and then eventually need hospital care. So we want to stay close to that, remain prepared, and help the Midland Medical Lodge folks as much as we can. We also know the health department will be actively involved in monitoring those cases and keeping us apprised of the situation there. So today I'd like to offer some thanks and recognition to our emergency department team. While the volumes in the ED have been down, we have also asked them to be the very first point of contact for sick patients who may or may not have the COVID-19 virus. They've had to learn new procedures. They've implemented masking of patients as they come in, limitation on visitors, things that increase the level of tension and recognize the level of risk that our frontline providers deal with every day when they don't know exactly what's going on with the folks who come to them for care. The ED has stepped up for that challenge without any question, with good spirits and positive attitudes, and we're very proud of the effort that they've made every day and continue to make to provide that frontline care that people, not only those suffering from respiratory disease, but everything else that continues to happen in our community, injuries, accidents, heart attacks, strokes. Those things are not on hold just because we're dealing with a pandemic, and the ED team stands ready to care for anyone who shows up in need every day, as they always do. So thank you very much to our ED team, physicians, nurses, EMTs, nursing assistants, the whole group. Thank you very much. That is the extent of my prepared remarks for today. I'll be happy to take questions. I know there were at least a couple that were already queued up from Facebook.
We have a question. Is Midland Health furloughing any more employees? If so, how many in approximate in total? And how long will these workers be furloughed?
The question about furloughing employees, I suspect, relates to the hospitals in Odessa, not to Midland Memorial. We have not furloughed any employees, nor have we stated that we intend to. I suspect that may be a misunderstanding of who's involved. I can tell you that we do have serious financial concerns. We've talked about those on these briefings a couple of times. We had a pretty rough month in March. April looks to be probably a little worse as we experience what's likely to be a full month of no elective procedures of any kind and minimal volumes throughout the hospital. So we're actively involved in watching our financial condition and projecting what it's likely to be as things unfold here in the next few weeks. But one of the most important priorities we've set from the beginning is to take care of our employees as much as we possibly can, to keep people working, to give people different assignments if their area of work has been shut down or severely limited, like we've seen in endoscopy in the operating rooms. Those folks have been repurposed to other jobs that need to be done as we manage our way through the pandemic. Clearly, we do have areas of our system where there just isn't enough work to do, and day in and day out, we've asked people to take paid time off when there's not enough work, to stay home without pay if they prefer not to use their paid time. And we have evaluated a wide variety of scenarios to reduce our expenses as our revenue stream continues to be challenged. As of now, though, we have not furloughed any employees, and we do not have a plan to furlough any employees. Other questions?
We have a question on Facebook regarding success or usage of the drug regimen.
I think I'll ask Dr. Wilson to come and address that if he would. So the question is about a particular drug regimen or just any drug regimen? Sure.
Good morning. So I'm understanding that the question is about drug regimens for COVID-19 treatment?
The
Hydroxy,
yes.
Sure. Okay. So Plaquenil or hydroxychloroquine is one of the medications that's been shown to have some promising influence on the COVID-19 infection. It's been shown in some studies to decrease the viral load and to improve the outcome of patients that are placed on it. Our infectious disease doctors here, in collaboration with the internal medicine physicians and critical care doctors that are managing our COVID-19 confirmed patients as well as our PUI patients, have been utilizing that regimen on patients that have been admitted that have been confirmed positive, as well as those that are PUIs that appear to be at high risk of being positive while we're waiting for their lab results. It's a 5-day regimen of therapy, and their observational feelings are that it's been positively influenced the outcome on some cases. We have had other cases that patients have not done as well, and they've been on the therapy as well. So it's a mixed bag, I think, at this point in time, but it has favorable outcomes in some circumstances, and it's been utilized around the nation, and we're utilizing in the high-risk patients and those confirmed to be COVID-19 positive currently.
Thank you, Dr. Wilson. Other questions?
Yes, we have a question from Mitch. Do you know if any other residents or staff members at Midland Medical Lodge, aside from those who have already tested positive, have begun to display symptoms of COVID-19?
As I understand it, they have isolated a small number of patients or residents on a specific unit, much like what we've done with medical surgical patients here in the hospital. And that includes both patients who have tested positive and those who are just suspected. Is that correct? And we will continue to stay on top of that situation daily to be sure we understand exactly what they're seeing and what we might be able to expect in the days ahead. Just testing.
We have another question from Facebook. Are we doing the plasma therapy here?
I believe there's been one case where the plasma therapy has been used. A reminder that this is not widely available for a couple of reasons. Number one, it's still investigational. Also, the plasma must be harvested from people who are known to have recovered from the disease, and there are relatively few of those in Midland. But we are actively talking about that every day. The FDA has a process that hospitals can participate in to understand where there are available resources and to use those on an emergent basis when we apply to them for that permission. And that has happened once so far. Certainly could happen again, but it's not going to be widely used in the near term. Okay, that appears to be all the questions for today. Thank you all very much. We'll be back tomorrow at 9 a.m. with the briefing from the Unified Command Team. Thank you.